From webinar. I'm Dr. Omera Buhsema, plastic surgeon from. I have been used with more than 3,500 fillers Algeness, and I cannot stop using it because I can say that when you used to use this product, you will never stop it. Let's see the property of this product, and just I want to introduce you this product. This is the first biodegradable, 100% biodegradable injectable implant in the market, and it's the company AAT based in Boston, United States. We produced the filler in Italy, more than 10 years history, and let's talk about what is Algeness. Algeness is a biomaterial consisting of purified agarose gel. After highly purification, it doesn't contain any protein and it's free from bacteria. It doesn't contain chemicals such as cross-linking agents. It's free from toxicity, and there is no microorganism inside it, and it's free from impurities. It's the safest material in the market to be injected. It's totally safe and biocompatible, 100% biocompatible. And how we obtain agarose? You know red algae. Red algae is a sea plant, and we get agar-agar from red algae. And after highly complicated purification process, we get pure agarose. It's not agaropectin, it's pure agarose. And what is Algeness's characterization? By means of structure, properties, performance, and processing. Let's talk about the chemically, what is agarose? Agarose is chemically a polysaccharide of a long chain of disaccharide units formed by 2 rings of 6 atoms. On each ring, there is 1 oxygen and 5 carbon atoms. It's not important for us, but you have to know that agarose is a hydrocolloid. You know, HA fillers are hydrophilic, but agarose is hydrocolloid. So it has some advantages. We will talk it later. This is the agarose, and it's a hydrocolloid. What does it mean, hydrocolloid? It means it doesn't recall liquids. HA recall liquids, but hydrocolloid does not. Hydrocolloid, it contains water in itself. Here, it contains water in itself, and when there is a compression, it releases water, and then after you finish the compression, it reabsorbs the water again. So this is a unique filler with this unique characterization. And also, you see here the agarose gel act as a structural support of the tissues, giving them 3-dimensional support against the external forces. This is the electron microscopic view of agarose gel. Also, it's a scaffold. You see, this sponge-like structure is also a scaffold. So it's very interesting. It has very interesting property. It is the cohesivity of this product is like a solid, but the diffusion transport properties is like a liquid. So it's very easy to inject it, but it gives a cohesivity like a solid. And this is very important for the structural support. It has very high G. We will talk it later. Due to its high G, we can give very good projection and very good contouring to zygoma, to mandibular margin. Okay, and let's compare agarose with hyomicat.
А как bunun şeyini çoxaldım, nə olar? Kömək elə də.
Okay,
Sesini eşitmemaktan.
Can we mute the voice?
Yes, done. Okay,
done.
sorry.
Okay. Let's compare with agarose and hyaluronic acid. This is the molecular structure of agarose, and this is hyaluronic acid. Both of them is polysaccharide polymer. Just the chains and bindings are a little bit different. And by this way, agarose is hydrocolloid. The hyaluronic acid is hydrophilic. And let's compare again. Algeness is 100% natural product. And it contains only saline and agarose, no chemical inside, no impurities, no protein inside, so no allergy, no granuloma. And the degradation is 100%. Only by macrophage activities, totally natural degradation. And after degradation, there is no residue. This is very important. In cross-linking HA fillers, I mean cross-linking, not only HA, but cross-linking HA fillers, there is chemicals inside for cross-linking, like BDD, PAG, and others. So there is no known degradation of cross-linking chemicals. And it means that this is not, the cross-linking agents cannot degrade 100%. And maybe after 3 years later, after injection, you may see some granuloma because you cannot degrade cross-linking agents 100%. The biggest problem in this kind of fillers are granuloma. So if you cannot degrade the cross-linking agent, it means that after a while, maybe 6 months later, maybe three years later, you can see some granuloma, maybe some fistulization and big problems. Okay, and resorption process of agarose, it's totally natural by macrophage in the reticuloendothelial system, by galactosidase enzymatic action and destruction in the pentose cycle. It's totally natural way, not enzymatic way. And here you can see the degradation, not degradation, we cannot degrade, but we can disperse the agarose only with saline. You see the dispersion of the product with saline. That's immediately. So if you want to disperse the product, you can just inject saline. Okay. And what are the benefits? Again, 100% natural and biocompatible. It's non-allergic because it doesn't contain protein. It's 100% biodegradable. This is very important. And it has unique physical properties of viscosity and plasticity. It has very good G prime, and you can give very good shape to zygoma, to chin, to nose, with very good contouring. It's chemical free and no granulomatous activity. We know this. We have never seen any granulomatous activity with this filler. And no capsula, it means very, very less capsula, like you inject saline. And no inflammatory reaction. And when we compare collagen, HA, and Algeness, you can see in the studies, this is in PRS study, the Algeness has very, very less capsula and very low inflammatory reaction. And let's talk about the degradation time and the product's persistence, because everybody asks, when we inject Algeness, how long does it last? And we have a few studies on human skin with Algeness, HD, for example, with HD, 1%, 1.5% concentration, and it lasts 3 to 6 months. And we can say that the persistence of Algeness depends on the concentration. We have 4 different types of concentration: 1, 1.5, 2.5, and 3.5. So the persistence depends on the concentration and the macrophage activity of the area. For example, if you inject deeply on the supraperiosteal area, the macrophage activity is high, so you have to inject 3.5 to have a long-lasting result. But if you inject subdermally, you can use 1.5 or 2.5. Okay, and when we talk about the degradation time and the product's persistence, we have to talk about the realistic expectation also. Why? Because, for example, if you want to augment the chin, the dimensions, for example, 3.8 and 1.8, if you want 0.4 millimeter projection, you have to inject 2 shrinks and 2.8 ml injection. If you inject 1 ml, you cannot achieve this result. So the result, you have to be realistic, and it depends on the amount of the product. 1 ml means 1 ml when you inject Algeness, not more or not less. It's not like HA. Sometimes HA, if you inject 1 ml, the result is less than 1 ml or more than 1 ml. It's not stable. But but in Algeness, it's very stable. If you inject 2 ml, it means 2 ml. You can see the result immediately, and that result is the final result. Let's talk about the chart of Algeness. Here you can see when we inject 1.4 ml, it degrades constantly. 3.5 lasts like 15 months to 16 months, 2.5 like 11 months to 12 months, 1.5 to 6 to 7 months, 1% it lasts 3 to 4 months. Okay, but when you look to here, the constant degradation after 6 months or 7 months, it means that you have 1 ml, not 1.4. So sometimes patients say we inject 1 shrink, but 6 months later, it's not the same as the initial. Yes, of course, because the half of it degrades in 6 months or 7 months. So just consider this. The degradation is constantly with Algeness, and after 6 months, after 7 months, you can see the half of the initial product or volumization. We have 4 different concentrations: 1, 1.5, 2, and 2.5 and 3.5. We can use this product everywhere in the body, but we have to concentrate now in this webinar to some specific areas, especially for the beginners. These areas are very easy to achieve very good results: zygomatic arc, nose, nasolabial fold, jawline, and chin. These are the main areas that we use this product very deeply. We never use Algeness intradermal because it has very low migration rate. You see this structure, it's like a sponge and reticular structure, and it's really difficult to migrate. So when you inject, it stays there. If you inject into the dermis, it's really difficult to disperse in the dermis, so you can see some lumps. We never use this product in dermis. Only subdermal and deep injections, maybe subperiosteally. And in 3,500 cases, I see never complication about this filler. If you know the good injection technique, there is no complication. Just look how can we inject this filler and where can we inject. The areas where the volume loss is most visible is here: malar eminence, hollow cheeks, lower eyelids, nasolabial fold, and perimandibular crease in these areas. Also, not by aging, not by loss, volume loss, constitutionally, there may be some deficiency. So we can just put some volume and add some volume to chin, to nose, to zygoma, to cheekbones, not only by aging process. But in aging process, we see some fat pad shrinkage and fat loss in deep fat compartments. By aging, we lost not only collagen, not only elastin, also we lost fat and bone. And we lost fats in deep compartments, especially in deep facial fat pads, not superficial ones. So we have to inject, we have to replace deep facial fat pads by aging. Here there is three most replaced area, fat replaced area. One is lateral soft, the second is medial soft, and the third one is deep medial cheek fat. We replace these fat losses by aging. And also you see the bone resorption by aging, especially here in the around of the mouth. Here you see canine fossa and the chin, and here the maxilla, the bone resorption is too much by aging. And we can replace the volume by Algeness very easily in bone remodeling, bone replacing, furrow filling, wrinkle filling, and to reshape the face. Let's look at where can we inject Algeness products. Here, this is 1%. We inject it just beneath the dermis. This is dermis. We cannot inject into the dermis, this filler. This is just beneath the dermis, 1%, and 1.5% hypodermis, and 2.5% deep hypodermis, and 3.5% into the muscle or supraperiosteum. Our injection technique is linear retrotracing technique. We just introduce our needle or cannula and parallel to the skin, and then inject, slowly withdrawing the cannula or needle. So our main injection technique is linear retrotracing technique. We avoid to inject bolusously. As I told before, you may see some lumps if you inject big bolus in the soft tissues because there is no migration. So you have to disperse the product into the soft tissues. Yes, and pre-procedure considerations, we just get, we inform our patients about the limitations and risks. And the expectation must be realistic. We have to talk with patient on a planned treatment because sometimes the patient's expectation is to lifting the skin, to hydration of the skin, but this is only volumizing the face. So if this is only 1-2, you cannot correct everything with volumizing. So you have to talk with patient on a good plan, and you have to talk patient with the medical history, including previous dermal fillers, implants, threads, or keys in the injection area. If there is previous dermal fillers, implants and threads or something like that, you have to be very careful and talk with the patient that when you inject Algeness, you can reactivate problems about the previous treatments. So the problem is not about Algeness, not about the agar-oz gel, but it may be the previous problems. You can ask for if there is any allergies, if there is any problem with lifestyle factors, and if there is any complication in previous treatments, you have to know them. And always take pre-treatment photos, because the expectation is sometimes very, very high. But you can show the differences with pre and post-treatment photos very easily. You can show the differences. So you need pre and post procedure photographs, and never treat patients with infected skin. And if there is dental abscess, don't treat these patients. If they are currently taking antibiotics, it means that there is some problem, so you have to wait to finish the antibiotics. If there is any known hypersensitivity or allergy to this material, we have never seen, but maybe you can ask. If there is a severe allergy or anaphylaxis history, you have to know it. If there is bleeding disorders, if they use some medications, what prolongs the bleeding, you have to know it, like aspirin or something else. If there is pregnancy or IVF treatment, we don't use any kind of fillers or botulinum toxins. We don't use them. And timing with other aesthetic procedures, for example, botulinum toxin, it's better to wait 2 weeks if you do botulinum toxin in the same area. For example, if you do botulinum toxin in maxilla area or the frontal area, if you inject there a filler, it's better to wait 10 days or 14 days to do the filler. Or after filler, you can wait 10 days or 14 days and do botulinum toxin. So it's better to give a time between these treatments. Also with IPL, chemical peeling, microdermabrasion, or laser resurfacing, there is some inflammation in that area. So it's better to wait 1 or 2 weeks pre or post treatment. And if there's permanent fillers, some surgical inserts, or some solid implants, you have to be careful. And maybe you may not inject filler in that area, because permanent fillers are always problem. And if there is temporary HA fillers there, you have to wait. If you have to wait 2 weeks if there is any injection of HA filler. After 2 weeks, you can use Algeness. But don't forget, when you inject the same area, Algeness and HA filler, if there is any problem about granuloma, the reason is HA filler, not the Algeness filler, because Algeness filler is the safest material in the market. And we need an agreed plan, and we need signed patient consent, and we need good candidates. It's very important to patient selection. We need to good candidates for good results. And we consider the patient needs, what they need. You know, the Algeness or other fillers are just volumized. If the patient needs some lifting, maybe you can use threads. If the patient needs some hydration in the skin, you may need some mesotherapy products. And pre-injection, it is very, very important to work in asepsis condition, because in this filler, we just do massage after finishing the injection. So it's better to use sterile gloves and gauzes in the injection process. You can use anesthetic ointment. You can inject some local anesthetic. You can use some cold instruments before and after the injection. But the most important thing is to work hygienic conditions. It's very, very important. And this is the Algeness box. Inside the box, there is 2 packages, and each has one shrink of 1.4 ml product. And inside the package, for 1% and 1.5%, there is needle 30 gauge. In 2.5 and 3.5, there is needle 27 gauge needle. And when we open the package, this is the shrink. It has 2 parts with dual lobe connector, and we have to mix it very true because we need to homogenize it. So when we open the package before injection, we have to mix it maybe 20 times or 30 times, like here. Okay, it's very easy to mix it for homogenization. Okay, before mixing it, you can just add some lidocaine, 0.1 or 0.2 ml lidocaine inside it. Okay, and when you inject, you have to stop the pressure before removing the needle or cannula. Don't forget it. And because if you don't stop injection when you're leaving the skin, there may be some little lump in the dermis. So you have to be careful about this, okay? And you cannot compare HA fillers with Algeness. The injection technique is a little bit different, and the characteristic is different, and the injection levels are different. So you never compare HA fillers and Algeness, okay? So you have to understand the agarose gel properties and its unique characteristics, its plasticity, and you have to know the proper injection technique, the plane of injection. So these are essential for a good result, okay? And let's focus on, in this webinar, let's focus on zygomatic arc and midface, jawline and chin, and nose and nasolabial area. Here, let's talk about these 3 areas. Here, there is 3 main areas in cheek and zygomaticomolar region, okay? One is anteromedial cheek region. The second one is zygomaticomolar region. The third one is submolar region. What is the difference in injection plane? Here, in zygomaticomolar region, we inject supraperiosteally. Here, 2 areas, anteromedial, it's mid-cheek area, and submolar region, we inject deep subdermal area, deep subdermal plane. Generally, we inject here, zygomaticomolar region, 3.5 concentration. We have very good results with 3.5. It has very good G prime and very good shaping and contouring and projection properties. So we use 3.5 here. In anteromedial cheek region and submolar region, we can use 2.5 or 1.5. We can use here cannula. I generally prefer to use cannula in this area, but some experts can use also needles. For cannula, we use generally 25G cannula. By needle, 27G needle. Here there is this three area. Here supraperiosteal injection. These two area we inject deep subdermal. But don't forget this area, mid-cheek area, is a very high tendency for swelling. So you have to know the risk of edema in this area. Why there is too much edema in this area with any kind of fillers in HA, even with fat, you can have some swelling and edema here. The reason is lymphatic vessels are very condensed and very high here. So each injection may compress to lymphatic vessels. So how can you avoid swelling here? You may inject less concentration and less amount. So that's why I sometimes inject only 1.5% filler here. Okay, let's see the injection technique here in the zygoma and mid-cheek. We always draw outlines of injection area. It's very essential for symmetry. Stay at least 5 millimeter below the orbital margin. You just palpate the orbital margin and at least 5 millimeter below the orbital margin. And this is our one entrance point for both zygoma and the mid-cheek. We just inject here lidocaine to entry point. You can inject with lidocaine with adrenaline or pure lidocaine, no problem. And we use generally 25G cannula. We introduce our cannula and touch the bone, and then parallel to the bone, supraperiosteally, injection in this area. This is half shrink of 3.5. We will inject other half to here. And this is half means 0.7 ml, 3.5 Algeness to zygomatic arc. It's enough. And linear retrotracing technique, 3 or 4 times with drawing the cannula. And you can inject a little bit very deep here in the lateral SUF, but very deep. You have to be very careful here. If you inject superficial here, you will see very bad edema. It's molar mole. A SUF injection should be very deep. And then we take 1.5 agarose gel for the mid-cheek area. That's why I prefer this one, because there is a tendency for swelling. I don't want to use too dense products here. So that's why I use 1.5 or 2.5. You can push up the cheek to introduce your cannula in the deep fat compartment. This is the technique. Okay, from one entry point, we inject both mid-cheek and the zygomatic bone. I generally use sterile gloves and sterile gauze, and I do my massage with sterile gauze. And we mold the filler until we cannot feel it with your fingers. After injection, if you don't feel the product with your fingers, that's finished. There will be no complication. You see here the lifting effect and the projection. Yeah, here before and after, you can see the projection and augmentation. Okay, here other example, only zygomaticomolar area, 1.1 ml each side. Here, only injection to here. Very, very natural results. This filler is not like HA. You can get very, very natural results because there is no swelling because of the material. There is no artificial appearance. It's very, very natural because it's hydrocolloid filler, and the results are really nice. And after 2 sessions, 3.5 and 2.5, 3.5 for here, 2.5 for here, the augmentation in the mid cheek and the zygoma. And you can correct scars, depressed scars also in cheek area. You have to be careful while correcting these deformities. You have to be just beneath the dermis, and you need to introduce your cannula here and do some subcision, and before injecting your product. After subcision, linear retrotracing technique and disperse and bimanually massage with your finger, and this is the result after 20 months. It is really long lasting if you inject 3.5 just subdermally. But you have to be very careful. You have to be expert to use 3.5 subdermally superficially. And cheek and lower face, we generally use here fanning technique and not very deep, because here there is no bone. We cannot go supraperiossally. If we inject very deep, we can just introduce our cannula or needle to parotis tunnels. So it's very complicated. We have to inject subdermally here with our cannula. Let's see a result in the lower face. This is a patient. We treat the lower face with fanning technique and with cannula with 1.5 and 2.57 shrinks, and this is 3 months after. You see the results. We just correct the distortion of the face with upper face and lower face and correct the distortion, and the result you can see very, very natural. And let's talk about jawline and chin. You have to know the anatomy very well everywhere. Here in chin, the safest plane, I think, it's the midline. You can inject very deeply here, but you have to be very, very careful while injecting laterally, because there is mental artery here, and you have to be careful. Normally, the injection technique here, you can inject very deeply, just deep subcutaneous or on supraperiossally. You can inject, you can touch the bone with needle and inject small boluses and inject into the muscle, because it's a very thick skin here, very thick skin. So it's easy to inject here the small boluses. Normally we don't inject in bolus style, but here when you touch the bone, you can inject small boluses with needle. But here in mandibular margin here and jawline, I never inject deeply on the bone surface. I always inject with cannula and always inject deep subdermal plane. If I need, in the corner of the mandibula, I can inject, I can touch the corner of the mandibula and inject some small boluses here, but the other places in jawline, I always inject with cannula and with deep subdermal plane, not supraperiossally. Okay, and okay, let's talk about the protocol, injection protocol in the video. And in hyperdynamic mental muscle, if there is hyperdynamic mental muscle in dimpled chin, here you can see, let's see the movement of the mental muscles, you see. It's better to use botulinum toxin 1 week before, because if the mental muscles are too hyperdynamic and too strong, when you inject filler, it may migrate. So it's better to stop this movement of the muscle with botulinum toxin, just 5 in unit, not too much laterally. In the middle point, 5 and 5, 2 points is enough to stop the muscles here. This is a patient with 3.5 swing, 3.5 concentration with 3 swing. You see, we augment here, not only the tip of the chin, but a lateral injection to here to augment totally here. And this is the projection with 3 injections, 3 in swing, 3.5 Algeness. Okay, and this is another patient. We inject full face, full lower face, in a 2 session with 14 swing. We augment totally the chin and the lower face. So you need more than 10 swing in this kind of patients. Here, sometimes patients want pyramidal bolus injections. They want pointy chin. So if they want something like this, a pointy chin, you can use pyramidal technique. You introduce your needle here, you touch the bone, and first inject in the middle plane, 0.4 ml bolus, and laterally 0.3, laterally 0.3, and submental muscle 0.3, like pyramidal technique. We will see it in video. And sometimes we need some combined procedures for jawline and chin. In this patient, if you don't do liposuction, you cannot achieve good results. So we do liposuction, and we did here agarose gel augmentation, Algeness augmentation in chin and jawline. Okay, you can see now here, this patient, we will inject nose here. We will inject very small for contouring here in zygomatic area. And here, we just touch the bone and inject 0.3 or 4 ml, 0.2 or 3 to lateral aspects, and then inject a little bit submentally, but don't go too much laterally. In deep plane, there is artery here, so you have to be careful. Okay, and then it's finished. This is the finished chin, and this is the finished appearance of the nose and the cheeks. I think it's good result for nose and chin. Here is the result for nose, for zygoma, and for chin. Again, this triangle is important for patients. And this is an injection to prejawal area here. She doesn't want any facelift or surgery. So we decided to inject this prejawal area to camouflage of the sagging face here. So we inject 2.5 and 3.5, 3.5 deeply, 2.5 subdermally here. And this is after 6 months. And this is after 2 years for the initial treatment. You see the product is still here. She lost weight, okay, but you can see the product here, and we hide the sagging face after 2 years by injection prejawal area. Okay, let's talk about nose correction. This filler is one of the best filler in the market for nose. Maybe for me, it's the best filler. Why? Because there is no swelling. So it just simulates the bone and cartilage. So the results are very natural with agarose gel. There is 2 different types of injection in nose. One is to hide the hump. If you want to hide the hump, you can inject a little bit here in radix and here supratum. So you achieve a straight dorsum. And you may inject here in columella area, in the very deep plane. You have to touch the maxillar crest and then inject to correct the droopy tip. And the second thing, the second injection technique is to augment the whole dorsum. In Asia, we know the people like to augment the whole dorsum. So this is two different types of injection. Sometimes we use needle for this type of patients, but we use always cannula to whole dorsum augmentation. You have to be careful of the vascularity, especially here. This area is really dangerous area. You have to be very careful. And nose also is dangerous area. You have to be careful. I will show you from a surgical operation the plane. Where is the safest plane when you inject your filler? In nose, the safest plane is subsmas area. Why subsmas area is very safe? Because it's relatively avascular area. You will see now this area. Okay. Okay. Sorry. When we inject our filler, we introduce cannula from here and under the smas. You will see on the bone, supraperiosteally, this area is very safe because it's avascular. There is no bleeding here, you can see. No artery, no vein here. So you have to inject very deeply in nose or intradermal injection. But we cannot make intradermal injection with agarose gel, so we have to inject it supraperiosteally. It means subsmas. We can inject 1.5, 2.5, and 3.5. If the skin is very thin, you need to inject 1.5. It depends the skin quality and the skin thickness. If the skin is very thin, you can inject 1.5. If the skin is good, you can inject 2.5 or 3.5. You have to aspirate as all injections, and you need slow injection, small amounts each time. Okay, and let's look here. The nose injection protocol depends your injection techniques, but normally we use cannula. It's safer than needle in so many cases. For nasal tip support, we use 25G cannula. For dorsal augmentation, we use generally 22 gauge and rigid cannula. Why 22 and why rigid? Because we don't want to inject wrong place. We need rigid cannula, and we have to see it from outside. Where is the cannula? So it should be a little bit thick to see to see from outside. We have to see it from outside. So I generally prefer 22 gauge needle and rigid 22 gauge cannula and rigid cannula to see where I am. Here we will correct some deformity after rhinoplasty, and you see the skin is very thin. So we want to camouflage the irregularities in the dorsum. We use 1.5 because the skin is very thin. This is the cannula. We introduce it, and very deeply, supraperiosteally, we go onto the radix. And why I am doing some movements like this? Because I want to dissect the fibrotic tissues, because this is a secondary rhinoplasty operation. So there is some fibrotic tissues, and I do some subcision and dissection to create a space for my filler. If you create a space, it's much more better and homogenic injection with the filler. So always dissect in fibrotic areas with your blunt cannula. Okay, each time you can inject 0.2 ml, linear retrotracing technique, and you see non-dominant fingers are in the lateral wall of the nasal bones. We just give pressure to the vessels laterally here to avoid any vascular complication. We have never seen vascular complication with agarose gel, and we will talk it later. We never see a vascular complication with agarose gel because it's much more safe product when you inject accidentally into the arterial space. Okay, we finished the injection now. She needs a little bit tip elevation, but okay, we just inject this just for the camouflage of the irregularities of the dorsum. So that's enough for us. Now there is a thicker dorsum here, and we cannot see the irregularities in the dorsum. Okay, I like to tape after nose fillers because only one night, the day after, they can remove it. Because why? We just close the entry point, no infection, and it prevents from swelling and migrating. So always I do some tapes after injection, only for one night. The day after, they can remove it. And they feel themselves very safe with these tapes. Okay. Now you will see the before and after photos at the end of the video. Never do overcorrection in nose. We do camouflage to the irregularities of the dorsum. You see here some depressions and some irregularities. Here you can see the edge of the cartilage and bones. Here you can see some furrows, some deformities, and we do camouflage in the dorsum. Okay, and we can do some nose corrections after deviations or broken noses. Here there is a deviation to the right side. Okay, if we inject a little product here, this is outline, we draw it like this. We can correct the appearance of the deviation. This is before and this is after. Just inject the other side, the opposite side, a little bit product, and this is the result. And very natural, no swelling here. This is very important. This product is one of the best products in nose because there is no migration, there is no swelling, and very natural results. Again, a crook nose, after breaking her nose, we just inject the contralateral side with agarose gel 2.5 with cannula, and we correct the deformity without surgery. And this is total dorsal augmentation with cannula. And this is radix correction after rhinoplasty. And this is also inject to radix and suprative to achieve a straight dorsum immediately after. Okay, let's talk about the temple. Normally, temple is a dangerous place, but in some techniques, we can use relatively safe techniques to inject into the temple. And one-shot injection, there is only, this place is the only place that we inject bolusly Algeness, okay? No other place we inject bolusly, but here we inject big bolus Algeness. Why? Because it's too deep, it's a conic shape, so we feel it, and the muscle here is too thick and it's covered the whole product. And we need very big projection here. So we inject big bolus here. This is the temporal fusion line. Just determine the temporal fusion line with palpation, you can find it. 1 centimeter up and 1 centimeter below. This is the suggested injection point. You can easily palpate this point, this area with your finger, and you can understand very easily here. And we use 27 gauge needle and just perpendicular to the skin, and go and touch the bone, and then aspirate, and then inject slowly 1 or 1.4 ml, totally one-shot injection. After injection, this slow injection, we do some gentle massage, that's all. And warn patients, there may be some pain for a few days, especially during mastication. So they can use painkiller for a few days. Here we can see a video here. You see, this is the temporal fusion line, go up 1 centimeter and go down 1 centimeter. This is your suggested injection point here. Okay. We use 3.5 in temporal area. There is another technique to superficial injection, but for beginners with this material, I always recommend to inject supraperiosteally here, because it's much more better and much more easy to achieve good results. I press my finger here not to migrate into the hairline. So I just push my finger here. I touch the bone, and then slowly, inject the 3.5 concentration onto the bone. When I finish it, I just remove my needle and very gentle massage, not too strong massage with gas. I always try to massage with gas because there is needle entrance here. If you touch with your gloves, there may be some infection if you don't use sterile gloves. I use sterile gloves, but if you don't use sterile gloves, do your massage with gas, sterile gas. Okay. Now this is the finished, no pain, no swelling, and very natural result here. Maybe there will be a few days some tension here, and it may create some headache. You can use painkillers, it's not a problem. Okay, and this is one case of Johan here injected in the temple. Let's talk about nasolabial folds. Here, this green area is relatively safe area. You have to inject in nasolabial area here. And what is the depth? The depth is, this is the, sorry. Okay, this is the bone level supraperiosteal, or you can inject deep subdermal. You can see the C line, this line. Be careful here, because in this line, there may be facial artery. So you have to stay there, stay here in green. Recommended injection site is this green place. there may be some facial artery or variations here. So don't go up, just inject here. Here, in this green area, you can inject subdermally. Here, in this area, you can use your needle and touch the bone and inject on the supraperiosteally in the canine fossa. We will look it later with video. And you have to be careful in these two areas. These are danger zones because facial artery is very superficial in these two areas. So you have to be careful. We use 2.5 or 3.5 in nasolabial area. We inject deep subcutaneous. Maybe we can inject here in canine fossa supraperiosteally. And we aspirate every time before injection. We can use cannula or needle. 27 gauge needle or cannula is okay for here, or 27 or 25 gauge cannula. Inside the package, there is 27 gauge needle. I generally use needle, but it depends. You can use also cannula. Let me show you in the video. This is Giorgio's video. As me, he is using needle in this area. If you are experienced, needle is really nice in this area. You see linear retrotracing technique, very slowly, each time small amounts, and linear retrotracing technique, fanning technique here. And don't forget to stop injection when you remove your needle, because if you go on injection, you can see some, in the dermis, you can see some small lumps. So you have to stop injection before leaving the skin. Okay, this is one of my case. We just calculate the length of the needle, and then this is the introduce our needle to subdermal plane and go up, aspirate, and after aspiration, just linear retrotracing technique, injection technique that we use, okay? But always aspirate before injection. And go up again. This is fanning technique. We inject several lines here with linear retrotracing technique. This is 2.5 concentration. Generally, we use 2.5. Fanning technique, you see. We try to disperse the product here, never inject bolously here. And after injection, we do some proper massage, not too strong, just to disperse the product. And when we finish the massage, if we still need some volume here, we can feel the canine fossa if we need. Touch the bone, aspirate, and inject and feel the canine fossa here. This is very important. In 90% of my cases, I do canine fossa injection. Each time 0.1 or 0.2 ml to feel the canine fossa, and then inject. You see the result. It's really nice. We feel the whole area here. Okay. And this is another case example for nasolabial injection and lip injection. This is nasolabial injection and lip injection. This is nasolabial injection with 3.5. Why? Because the skin is very thick, so you can maybe use 3.5. This is Giorgio's case. He correct the nasolabial area, and also he correct the asymmetry of lip with agarose gel. Normally, we don't recommend you to use agarose gel in lips because it's not hydrating, it's not swelling effect, but so many women want big lips and swelling lips. So I recommend you to go on with HA, no problem. Okay, this is a nasolabial and marionette injection, fold injection. And post-procedure requirements. It's there may be some swelling after injection. It is very common. After all kind of injections, it is very common especially in mid-face and malar areas. But it's the most of them, it's temporary. And you can warn patients. There may be some swelling, so they have to be ready to get some swellings for maybe 24 hours, maybe 48 hours, 1 or 2 days. And warn patients that nodules can rarely occur. But I can assure you that I have never seen any nodules or lumps with Algeness. Maybe a few cases when I first start to use this filler, and it was my fault. It's due to injection technique. If your injection technique is proper, you never see nodules. So if the injection level and the plane is true, if the product you select is true, if your injection technique is proper technique, there is no chance to get a nodule with agarose gel. Okay, and after a procedure, we don't want patients to go under sun for a few days, no makeup for 1 day, no smoke, no touch to area the day after, until the day after. And let's talk about a little bit avoid and treat the complications. Always think that if you inject something, there is a potential for complication. This is an injection. Whatever you inject, there may be some complications. Most complications are minor and temporary. Major complications are really rare. We don't see with agarose gel, but in so many fillers like HA, like calcium hydroxyapatite, even with fat, we can see some complications. So we have to talk about it, but with Algeness, we don't see them. But we don't see complication with material, not your injection technique. For example, infection. In all kind of injections, you can see infection. If you don't use sterile techniques and hygienic conditions, you can see infection whenever you inject. And there may be some edema. It's very common because you do some massage, you do some needling. Even if you inject saline, there may be some edema and erythema. This is not problem. These are really temporary. There may be some pain because you are needling. There may be some bruising because needle can disrupt the arteries and the capillaries, so the bruising is possible. The itching, yes, the needling, after needling, there might be some itching. It's temporary again. The nodule is due to not inject in proper technique and the superficial injections. So if you inject in the right way, there is no nodule. Abscess, of course, there may be abscess if there is contamination. The delayed complication, normally we never see delayed complication with Algeness if we inject in properly and sterile way in hygienic conditions. But in HA, you can see hard, painful lumps, nodules, granulomatous nodules, and erythematous nodules. Why? Because there is chemicals inside the HA, and you cannot degrade them. And if the body cannot clean these chemicals, the macrophage has become sequestrated, and then it becomes a granulation. But with our filler, we don't have any granulation. If you don't work in a good conditions and sterile conditions, you can see, of course, infection. And maybe if you have lump and if it is contaminated, of course, if you can see some painful and hard lumps with abscess. But don't forget, with this material, there is really no complication. The complication may be only lump, and this is about the injection technique and the injection, wrong injection plane, and maybe, superficial injection, and maybe the wrong selection of the concentration. Okay, if we place correct amount into the appropriate skin depth, there is no problem. Algeness is hydrocolloid, and we cannot compare it with HA fillers. So the injection techniques and the results and the expectations should be totally different. And Algeness is indicated for deep injections only. Here, this is dermis, and this is subdermal plane. You inject 1%, 1.5% just beneath the dermis, and 2.5% deep hypodermis, 3.5 into the muscle or bone supraperiosteally. Okay. To avoid complications, as we told, you have to ask for previous dermal filler injections, prostheses, implants, threads, medications, allergies, and lifestyle factors. We always take photograph before treatment, and with infected skins, dental infection, bleeding disorders, pregnancy, and IVF treatments, we don't treat this kind of patients. Strict asepsis has to be maintained during the procedure. This is very important because in our product, we always mold it to give shape and do massage. So you touch the area, so you need to use sterile gloves, even sterile gas, and clean the skin very proper way. Okay, we inject slowly and carefully in the subdermal and deep plane. We aspirate before injection. Don't rush, take your time, avoid large bolus injection. And when you finish your injection, you do massage to injected filler until you don't feel any product with your fingers. If you don't product with your fingers, it means that you can sleep very comfortably. There will be no complication in the future. Okay, to treat complications, we talk about the complications and how can we treat the complications. Bruising and swelling, it's very common. It's not a problem. To prevent from bruising, I generally use ice packs before and after the injection. Why before? Because before injection, if you put some ice packs, it leads to vasoconstriction and reduce the bruising. And if patients taking anticoagulants, you have to be careful. For discomfort and swelling, it's okay. It's needling. So whatever you inject with needle, there may be some swelling and discomfort. And for discomfort, you can use some anesthetic creams, or you can mix your Algeness with 0.2 ml lidocaine without adrenaline. I generally use lidocaine and mix it with Algeness 0.2, and this is reduced the discomfort. Normally, if you inject very slowly, there is pain, no discomfort. But after procedure, to maintain the anesthesia, I always use lidocaine, mix it with lidocaine. And lidocaine has antiseptic effects, antibacterial effects. Okay, you can use painkillers such as paracetamol. You can use paracetamol if there is any pain or tenderness. So no problems. It's very common. Temat. It may appear after immediately injection, but it's very temporary. If it lasts a little bit longer, you can use vitamin K creams. Maybe if it is prolonged, use steroids, because in some patients with spider veins or rosacea, it's a higher risk of developing erythema. For major complications, what is the major complication? The biggest major complication is blindness and the vascular complications. And we never see any vascular complication with Algeness. We do an animal study. We inject Algeness into the artery and then give some different medications. We give vitamin C, we give antithrombotic agent, and we give saline. And the fourth group, we give vitamin C and antithrombotic agent together. And we saw that even if you don't treat with anything, just warm saline can reduce the survival. No big necrosis. It's much more less necrosis than HA, even if you don't treat the patient. But if you treat only with anticoagulant agent like aspirin or low molecular weight heparin, there is no necrosis. So this is experimentally what we see. So if you use only aspirin, if you think that there is some vascular compromise, it's enough for our filler. But of course, you can put some other treatments beside this. I will talk it later. So let's talk about infection, the contamination. If you don't work in proper way or a hygienic way, contamination is possible. So the contamination through the skin, like that occurs during injection, or maybe mixing with lidocaine. So you have to be careful to work in hygienic way. If there's any infection, the first choice is to prescribe the antibiotics. And then if it is go on, it's not temporary, and if it's prolonged situation, you have to culture. And if there is any abscess, you have to punctuate and drainage. And when you do incision and drainage, always take culture. And sometimes when we inject too much filler, what can we do? With Algeness, this is not too much problem. We never do overcorrection. This is not hydrophilic. We see the results immediately, so we don't inject too much. But if you want to disperse the product, we can use warm saline solution. Just inject right into the filler and do massage. That's enough. You can disperse this product with warm saline. That's all. And if there is capsula, I didn't see any capsula with this filler, but if there is a hard and strict lump, you may maybe inject hyaluronidase. But don't forget, hyaluronidase is a dangerous substance. We just use warm saline so many times, and we use maybe sometimes vitamin C, but I never prefer hyaluronidase. Why? Because hyaluronidase is a dangerous product. It may cause anaphylaxis. It's a toxin in the bee anaphylaxis, the same material. So it's dangerous because you may lead an anaphylaxis. And also, if you inject hyaluronidase, it degrades also the normal tissues, normal collagen and normal support of the tissues. So it's dangerous if you use it a little bit superficial to dermis. It degrades the dermis also. So it's not safe to inject nowadays, and you know, it's not licensed to inject. Okay. And nodules. If before form the capsule, if it's just a few weeks after injection, you can easily disperse the nodules with immediately injection warm saline and massage. In the literature, they write here this, but I always use warm saline and massage. That's all. Sometimes you can use vitamin C. And if it is too late, what can you do? And if it is resistance to dispersion, what can you do? There is two different treatment option. The both of them is with mechanically dispersing. One is you can introduce a cannula, small liposuction cannula, and break the capsule by mechanically. The second one, you can inject the mixture of triamcinolone, 5-fluorouracil, and a little bit xylocaine with epinephrine, and inject to the right into the lump, and then 5 minutes later squeeze it and do massage and advise your patient to continue at home. And if there is no improvement, you can do your second injection 3 weeks later, because triamcinolone and 5-fluorouracil is really good agents to dissolve the fibrotic tissues and capsulas. For vascular compromise, as I told you, you can use only antithrombotic agents, aspirin and low molecular weight heparin injection to the injection area. Aspirin perioral and low molecular weight heparin injection to the injection area. Here days, yes, you can use, but I think antithrombotic agent, massage and warm compress, maybe nitroglycerin paste is enough. And delayed complication, what are delayed complication? As we told, lumps, different types of lumps, you know, and the problematic lumps, nodules are kystic, oedematous, and sclerotic nodules. Sometimes we need to excise it with surgical way, but generally we see these kind of nodules with HA fillers. Not Algeness. We didn't see any of these kind of serious problems with Algeness. But if you contaminated the injection, the material, you may see some erythematous lumps. So be careful to work in hygienic way. If there is oedematous and sclerosant type, and you can use intralesional steroid injection, maybe you may need some excision, okay? And treatment of lumps, the erythematous nodules are usually due to intradermal injection, but the treatment is absolutely be like, should be like the deeper nodules, no problem. And if there is any case of complaint, please fill the complaint form. You can download it from Algeness website and submit to AAT and AAT's clinical support department. Just mail it to clinicalsupport@algeness.com. After filling this complaint form, just send us the form and we will do our best to solve your problem. Provide photos of before and after treatment and photos of the problem object to the complaint. And this is our complaint form. You can fill this and send this to us. And this is the website of training, algeness.com. you can see so many training subjects here. Just take your PIN number and password and enter this site. You can see all details about training. And please just take the photo of this page, and you can send your mails with problems to clinicalsupport@algeness.com. You can also contact with me from WhatsApp, my personal WhatsApp number, and from my personal mail. Please never hesitate to contact with me if you have any questions.
Thank you, Omar.
Thank you for your attention. Thank you very much.
Omar, thank you. There is few questions.
Yes.
Then one question is, first question, and then I don't know how to answer to this, but is there any contraindications if patient has a schizophrenia? If the patient has schizophrenia, is there any contraindication?
I don't understand.
Schizophrenia, you know, these people that have two personalities.
Oh,
it's a mental illness.
Yes, of course. This is very important. The patients, the patient selection is very important. So these kind of psychological problems, you can never trust the patients, and you can never understand what are their expectations. So don't do injections to this kind of people. And also dysmorphic patients. You know, dysmorphic patients, it's very difficult to understand when you talk with them. But sometimes they say, I have very, very small ear. I have very big nose. And this is very important to select good patients and avoid from dysmorphic patients.
Okay, thank you, Omar. Another question, the second question was about, then this question about schizophrenia was Dr. Nuri Huda. And then now it's Dr. Madina that is asking if there is any antidote enzyme like Algeness. You already answered during the presentation.
Yes. Normally galactosidase.
And then it's not finished, Omar. And then the question was, is there any antidote, then enzyme? And what if I have already a necrosis? What can I do?
Okay. If there is any antidote to disperse this product, there is some antidote, agarase, but we cannot produce it and we cannot use it in clinically. So we don't have any choice to degrade it, but we have choice to disperse it. It's very easy to disperse it, and the problem is to disperse it, not to degrade it. And if you want degradation, just wait. No problem. 100% biodegradable, this product. If you can wait, it will disappear. But if you don't want to wait, you can just inject warm saline, maybe some steroid, triamcinolone, right into the lump, and just squeeze it and massage. It's enough. So we don't need some antidotes for this filler. It's not like HA. It's very safe, and no overcorrection with this filler. So we never need any antidote. I used near 4,000 filler, and I never need any reduction or any degradation. For vascular compromise, if there is necrosis, and what we mean if there is necrosis, in the first day, in the third day, in the fifth day, after 1 week, it depends. If it is very early, just start to use antithrombotic agents, aspirin, and wash the area with low molecular weight heparin. It still helps a little bit. After 1 week, what can you do? You can do nothing. Just try to prevent that area for microorganisms of infection. You have to prevent your area from infection, so you have to start antibiotics, and you can use aspirin, and after demarcation you can remove it. You can do debridation, just send it to surgery, plastic surgeon. But if it is early stage, you can use a few different treatments. One is hyperbaric oxygen. The second one is carboxytherapy. When you inject carboxytherapy, when you inject carbon dioxide here, it creates a rebound, and oxygen comes to there, dense oxygen. So oxygenization and vascularization increase. You can use different treatments, but it is an expert treatment. It's just let us know, and we will help for the solution if there's any necrosis. We have never seen with Algeness. Okay. Never.
Thank you, Omar. Next question from Dr. Daniel Yaparkung. If the patient has a previous injection of silicone into the chin more than 10 years ago, but now wants Algeness injection, would you consider to do it?
Okay. First of all, if there is previous injection or implant or whatever, the safest product to inject the same place is agarose gel, Algeness, because it doesn't contain any chemical, no protein. So the safest material that you can inject these kind of areas is Algeness. But if there is problem, and this problem is just capsulation inside the capsula. If you disrupt the capsula with your needle, you can reactivate some problems there. Okay? So, for example, there is a small kyst here or small granuloma there in the deep part. When you just broke the capsula or the cells with your needle, you can reactivate it. If there is any problem, this problem is not due to injection of agarose. This problem will be disruption to the previous material.
Okay, Omar, thank you. Is there any questions? If you have a question, you can open your mic and you can ask your question directly to Dr. Buhsema. No? Okay, then Omar, thank you very much. It's been a very nice...
Sorry, from Nurul Huda, which one is suitable for T-trap injection? Okay. For T-trap injection, we generally use 1% product, it's charm. And we introduce from here with one entry point from here, touch the bone, under the muscle with cannula, linear retrotracing way. We can talk it later because it's a little bit expert injection area, but the product for T-trap is 1%.
Yeah, this is more for, it's an expert technique, then we don't do the training for this area on first intention. We do it after for expert injectors. And for now, when you start, we advise you to start with what has been presented today, which is area, zygomatic arch, malar area, jaw lines, chin. Nose is also a bit expert. not
Okay.
the bit expert. But
Madina asks for how long will be interval between injections. I don't understand it with other fillers and this filler, or between 2 sessions with Algeness. I don't understand it very clearly, but if there is any other filler, 2 weeks later, you can do at the same place Algeness. But if you just repeat the injection 2 weeks later, of course, you can correct or you can touch up with Algeness. It's 2 weeks for touch up, or after hyaluronic acid. If you want to do some Algeness at the same place, you can do it after 2 weeks.
okay, looks like we are perfectly on time. We still have 5 minutes before to wrap up. If there is no other questions, I would like to first to thank you, Omar, for this beautiful presentation, very precise, very detailed. And I would like to thank you all attendants to this meeting. It's been a lot of your time, and thank you for attending. In all of your countries, our partners that send you the invitation for today are able to answer to most of the questions. But as Dr. Buhsema said, is available if you have technical questions. If you have other questions regarding marketing, you can ask either your distributor, your distributor, or you can ask directly to us and then to Sarah, that she's Eden, Sarah Zopello, she's our marketing manager, and we can bring a lot of support to you on anything you might need. Then thank you very